The Peristeen transanal irrigation system contains everything you need to irrigate your bowels. A water bag with a screw top, tubes, a control unit with a pump, leg straps, and balloon catheters. There are 2 balloon catheter sizes, regular and small. The small balloon catheter is marked with a smiley. Your healthcare professional will prescribe the size that's right for you. Remember to check that you're using the right size before you start irrigating. The control unit is used to control the irrigation process. There are 4 symbols on the control unit. When you turn the dial to the white symbol, you can pump water to lubricate the catheter and irrigate your bowel. When you turn the dial to the blue symbol, you inflate the balloon or stop the water flow. When you turn the dial to the green symbol, you can deflate the balloon. When you're done, turn the dial to the orange symbol. This will release the water and allow the system to dry properly before you use it the next time. Knowing the symbols will enable you to be more in control, so you can go backward and forward with the steps. For extra stability during pumping, you can use a leg strap to fix the control unit to your thigh. In addition to the instructions for use, we also provide a simplified step-by-step guide. You can get this guide from your healthcare professional or download it on the Coloplast website. You'll now see a demonstration of how to use Peristeen to irrigate your bowel. The demonstration is divided into 6 sections: getting ready, inserting the balloon catheter, inflating the balloon, pumping water, emptying and cleaning up. Before irrigating, empty your bladder so you avoid adding pressure to your bladder when instilling water. Some have found it useful to have certain items at hand for the irrigation, such as disposable gloves, a container to hold the balloon catheter during preparation, a thermometer to measure water temperature, antibacterial gel, something to clean yourself or the toilet with after irrigation, and a small waste bag for disposing of the balloon catheter. Some prefer to do the preparation steps in the sink to contain any water spillage. Start by filling the water bag. Flip the lid to open the water bag. The water should be close to body temperature. If it's too hot, it may harm the delicate lining of the bowels. If it's too cold, it may cause bowel cramps. You can use a thermometer to be sure that it's between 36 to 38 degrees Celsius. To properly read the volume scale on the bag, you'll need to fill the bag completely all the way to the grey lid, even though you may not use all the water for the irrigation. You may need to fill the water bag gradually, giving it time to expand so you can fill it completely with water. When you close the lid, make sure you hear a click, otherwise the system will not work properly. Connect the grey connector at the end of the tube to the lid by aligning the big tube with the big hole and the small tube with the small hole. Make a cross, push together, and then twist gently clockwise to lock. Gently tug the connector to make sure it's connected. Place the water bag on the floor near where you will carry out the irrigation. It should be positioned so you can see the volume easily. Now slightly open the balloon catheter packaging, approximately to the blue line or about 2 to 3 centimeters. Connect the blue connector on the tube to the balloon catheter by aligning the big tube with the big hole and align the small tube with the small hole. Make a cross, push together, and then twist gently clockwise to lock. Gently tug the connector to make sure it's connected. You can attach the packaging to a surface by peeling off the adhesive dots. Alternatively, you can place the balloon catheter with the packaging in an empty glass to contain any spillage. To lubricate the balloon catheter, turn the dial on the control unit to the white water symbol. Pump water slowly into the packaging until it reaches the blue line on the balloon catheter. To stop the water flow, turn the dial on the control unit to the blue balloon symbol. Then wait 30 seconds to activate the coating, so it's easy to insert. Remember that the balloon catheter is single-use only. Do not use the balloon catheter without having activated the coating first, and do not use any extra lubrication as it may damage the balloon. While you're waiting for the coating on the balloon catheter to activate, you can fit the control unit to your thigh. First, place the strap around the base of the pump. Thread it through the buckle and pull tight. Next, fit the pump to your thigh using the Velcro. Adjust the strap for a comfortable fit. Make sure you can turn the dial easily without the control unit moving too much. While sitting on the toilet, hold the balloon catheter by the finger grip just under the blue line. Insert the balloon catheter slowly into your rectum until you can feel your bottom with your finger. Do not use force. If you feel any resistance or obstruction, stop and contact your healthcare professional or Coloplast charter. While still holding the balloon catheter, pump to inflate the balloon to the appropriate size. One pump means squeezing the bulb until its internal walls touch one another, and then releasing your grip completely again. Your doctor or nurse will recommend an initial number of pumps and may make gradual adjustments to help you get a good seal for the irrigation. To help you remember, you can write down the number of pumps you need in the step-by-step guide. The air in the balloon should make the catheter stay in place on its own. Once inflated, gently pull the catheter down to seal off the rectum. Now turn the dial to the white water symbol again and pump water slowly into your rectum. To avoid discomfort, we recommend one pump per 5 to 10 seconds. If you experience any discomfort, you can stop the water at any time by turning the dial to the blue balloon symbol. Your doctor or nurse will recommend an initial volume of water and may make gradual adjustments to help you achieve proper emptying of the colon. Remember to write the water volume down in the step-by-step guide. This will help you to keep track. Check to see how much water you've pumped by looking at the water bag. Once you've pumped the recommended volume of water into the rectum, you can deflate the balloon. To deflate the balloon, hold the balloon catheter and turn the dial to the green air symbol. The balloon must deflate completely before you remove the catheter. The catheter will often slide out on its own. If it doesn't, gently pull it out while remaining seated on the toilet. You can dispose of the catheter right away or put it in the packaging for clean-up afterwards. The water causes a peristaltic movement of your bowels that pushes stool towards your rectum. As a result, water and stool will be expelled. Stay seated on the toilet until you stop passing water and stool. The time it takes to empty the bowel varies from person to person. On average, it can take about 30 minutes. If your bowel does not start to empty on its own, try to lean forward. Cough. Massage your stomach. Or move your upper body back and forth. If you haven't done so already, disconnect the balloon catheter from the tube by unlocking the blue connector. Throw away the balloon catheter with your normal household waste. Do not flush it down the toilet. With your system in the sink, twist counterclockwise to disconnect the grey connector from the lid and empty the water bag. Then turn the dial to the orange finish symbol. This will release the water from the tubes. Now hang the system to dry for at least an hour. Finish by washing your hands. When you store the system, make sure that the tubes are dry and without kinks. A bowel diary can help you keep track of your frequency and progress. It can take anywhere from a few weeks to months to establish a good Peristeen routine. Once a good routine has been established, you'll be able to decide when and where to empty your bowels. Coloplast is here to support your journey to succeed in TAI and, most importantly, can help make a long-lasting difference to your bowel management. Important note: the transanal irrigation procedure must always be carried out under the guidance of a healthcare professional. The instructions provided in this film are only intended as a supplement to the advice you have already been given. Before use, please consult the instructions for use document found separately in the box, as this document contains information about indications, cautions and warnings.